Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and let's talk a little bit about correcting deep bites or overbites or vertical correction in adults versus kids. I have a lot of videos that are already posted on just deep bite correction and all different ways you can do it, from absolute intrusion to relative extrusion to intrusion arches to anterior bite turbos to anterior bite plates to reverse curve wires, lots of different options, right? So there's no one size fits all approach. You need to really see what the patient's chief complaint is, what the staff says, what the smile says, what the aesthetics say, and then you need to come up with your plan. You can't just tell Invisalign, I want to fix a deep bite, because there's a bazillion ways to do it. And the way they're doing it isn't necessarily going to be right or look good on your patient. So you need to understand how you do it, and you need to tell the technicians, if you're doing aligners, how to do it. Now, this also presents another issue because a lot of you are trying to be cheap in terms of your selection, and you're saying pick on a light or a go. This is not going to work. You're not going to get deep bite correction with that. You have to do comprehensive. In an adult, it's going to take a long time. This is not going to be 30 trays. This is going to be 70, 100, 150 trays. It's going to be a really long time, depending on how you have to fix it and how severe it is. So that's the first mistake I see you guys doing, is you guys are trying to shortchange it. You're trying to cheap ass it, and it's not going to happen. So yes, you can always just straighten teeth and not correct the bite, but you need to explain the risks, benefits, and alternatives to the patient. What happens if we don't fix the deep bite, short term, long term? Because if you don't explain all this, what the risks, benefits, and alternatives are, you are liable as a dentist. You are, I don't care what country you're in, very much so in the US. Other countries, it's gonna happen. You need to explain to them, if you're shortchanging them with a cheaper, lower, quicker treatment plan, even if they're asking you for it, it's still your job as the doctor to explain the risks, the benefits, and alternatives. And if you don't offer those other options, if it's not something you're doing in your practice, you need to tell your patient to go to an orthodontist to get that evaluation and get that explained to them if you're not capable of explaining it. That is extremely important. You guys, the complaints are happening. Insurance companies, dental boards, and you guys are getting yourselves in trouble. And you're coming to me, so I'm very familiar with what's happening, and I'm trying to warn the rest of you who are trying to do these GO treatment plans, these light treatment plans, these express treatment plans, these anterior only social 6 treatment plans, what you need to do. But again, the question today was, how do we fix deep bites in adults? Well, basically, you need to go through all my other deep bite videos that I made, more for comprehensive, more for kids, to understand the different ways, from intrusion arches to positioning the bracket submission incisally to an anterior bite plate to anterior bite turbos to reverse curve wires, absolute intrusion, relative extrusion. So all those 6 different keywords that I just rattled off, you can look them up by keyword within my channel. So if you go to Straightsmile Solutions YouTube channel, there's over 8,000 videos. Pretty obvious. If you scroll over on the tabs to the right, so if you're on a phone, you're going to have to actually scroll. If you're on a desktop, you should be able to see it. You'll see a little magnifying glass, the right of all the words at the top. You can put in all those keywords: anterior bite plate, anterior bite turbos, relative extrusion, absolute intrusion, bracket placement, reverse curve wires, RCS wires, okay? And those are the different ways. We might use a combination of these ways in the patient, but unless we have a cephalometric x-ray, and again, if you want to know more about cephs and how we evaluate that, I have a whole section just on that. You can go through that. And you come up with a plan. These are all ways we do it in braces, but all of this can be programmed into a Clincheck. For Invisalign, somewhat into a clear pilot with clear correct, less so into a sure smile or reveal. The less sophisticated your aligner technology, the less likely you're going to be able to treat a case like this to ideal. I am quite confident you can do it in Invisalign. It just will take a very long time. Very long time, like years. So hundreds of aligners. But it's definitely doable. So if your patient is patient and willing to sit through the process and compliant and actually wear them 24 hours a day for a year and a half or 2 years, which is pretty much kind of normal orthodontic timeline. I mean, that's normal. That's how long it would take for me to fix that in braces. You can't expect aligners to work any differently. And this is one of the few situations where I can tell you braces is actually faster than aligners. Very few. There's very few. This is one where it's a hair faster than aligners. assuming we have a compliant patient. If the patient's not that compliant, it's a lot faster than aligners. So this is one of those situations, if a patient presented adult or kids and they were willing to have some hardware like this, and metal braces and wear elastics, I'm going to say, hey, we can probably do this in maybe 2/3 to half the time in braces than we could with aligners. This is one of those rare situations that is faster. So I'm all up for doing braces in these cases if the patient's open for it. They're going to complain, but it does work. All right, thanks so much.